An intriguing connection made in this study was the link between women's sexual freedom and mosquito-borne disease prevention. Development Bank through the Climate Investment Funds and implemented by the Project Management Unit of the University of the West Indies Mona Office for Research and Innovation. Climate change creates increased risk of human exposure to vector-borne diseases. Although these diseases are a high public health priority in the Caribbean region, few studies have explored the role of gender in disease transmission and prevention. In this episode of the CaribClimate podcast, we speak with Dr. Stuart Ivara, Scientific Director of the InterAmerican Institute for Global Change Research, Avriel Diaz, Executive Director of Walking Palms Global Initiative, and Willy Dunbar, a research associate at the Florida International University. Together, the team has been working with the Caribbean Public Health Agency on several projects related to climate and health in the Caribbean. Climate change creates new unknowns for vector-borne diseases. Dr. Stuart Ivara shares its impacts on human health and healthcare systems in the Caribbean.
So climate change is a major concern in the Caribbean, as we're well aware of. Small island developing states in the Caribbean are among the most vulnerable in the world to the effects of climate change. And when we think about health, we often think about how changes, for example, in extreme climate events like tropical storms, drought, or heat wave might affect people's exposure to infectious diseases like mosquito-borne diseases, respiratory infections, also with heat waves, thermal, heat stress, with people being exposed to really high temperatures that can be especially troublesome for the elderly and people with cardiovascular issues. And we also think about injury and mental health implications of having severe storms that might cause people to have to leave their homes and seek shelter. And so there are many different ways that climate change can affect people's health. Also, I wanted to mention nutrition and access to clean water. For example, droughts could affect access to food and clean water. We're actually seeing also ocean warming. So as ocean warming increases, that could affect local fisheries, affecting nutrition and livelihoods. So again, many different ways that come together. It's a complex process, and we need to begin to come up with really clear action that the public health sector can take with our local communities to address these challenges.
How do changing temperatures and weather patterns affect the transmission and spread of vector-borne diseases?
Good question. So vector-borne diseases mean any type of disease, infectious disease like a virus or a bacteria that's transmitted usually by an insect. So in the Caribbean region, we've had a lot of concern about mosquito-borne diseases like dengue fever, chikungunya, and Zika fever that are transmitted by the Aedes aegypti mosquito primarily. And the Aedes aegypti mosquito, like other insects, it can't control its own internal body temperature. And so as the environmental temperatures change, as the air gets warmer because of climate change, that affects the mosquito. And that affects its lifespan, how many days it lives. It affects how quickly it develops, how frequently it bites, how well it's able to transmit the virus. And so temperature has a major impact on these mosquito-borne diseases. And for example, Aedes aegypti has a range of possible transmission from about 18 to 34 degrees Celsius, but there's a peak, there's an optimal temperature. So around 29 degrees Celsius is the optimum temperature. So as that as the temperatures warm and more months of the year or more countries fall into that optimum temperature range, we could see more chance of disease transmission during the year. Also, I should mention rainfall. Rainfall also has a major effect on mosquito-borne diseases because these mosquitoes lay their eggs and the larvae of the mosquito will develop in standing water. It could be natural bodies of standing water. Sometimes you find mosquitoes reproducing in the water that accumulates in houseplants around the patio, or it could be containers that people use to store water, like buckets or water drums around the home. And so when we have a drought, that could even increase mosquito risk because drought can lead people to store water around the home. And if those water containers are uncovered, then we can see an increase in mosquitoes and increase in disease transmission. Similarly, after a severe storm event or heavy rainfall, maybe a few weeks later, we also see an increase in the number of containers with water, and that becomes mosquito habitat. We see an increase in mosquitoes and increase in disease risk. So again, rainfall is a bit more complicated, but also plays an important role in the risk of vector-borne diseases.
Now we see the big picture of climate impacts in the Caribbean. What is the role of data in strengthening resilience across the region's health sectors?
In the Caribbean region, ministries of health and CARFA have identified as a priority the need to develop tools so that the public health sector is better able to respond to these climate threats. And so when we think about these tools, these are sometimes called climate services or decision support tools for the public health sector. That could be something like an epidemic forecast model, so some kind of tool that predicts the risk of disease transmission in the coming months. Those types of tools usually incorporate climate information, like the seasonal climate forecast. So the forecast for the next 3 months to be able to say something about disease transmission in that time period over the next 3 months. So our team has been working with the Caribbean Public Health Agency and other national ministries of health to support the development of these climate services for the health sector or early warning tools.
As with other dimensions of the climate response, there is increased focus on incorporating gender considerations in health.
So there's been a lot of talk at the recent COP26 and other global forum about the importance of thinking about gender when we plan our climate change adaptation strategies or climate change mitigation strategies. We know that men and women have different roles depending on local culture and local social norms, and that can affect how they're affected. That can affect their exposure to mosquitoes, to infectious diseases, and that needs to be taken into account when developing these climate change plans in the health sector. And so we've been doing work also to better understand the role of gender in the transmission of these mosquito-borne diseases and also in the vector control programs, how we can mainstream these gender dimensions into future plans.
The project developed data-driven resources like a health audit toolkit. How does this toolkit support the sector in managing climate challenges?
We work with the countries, with the states, mainly in Jamaica, Haiti, and St. Lucia. So we were in those countries to see exactly what is going on, who is doing what, and how the processes are going on. So technically, the goal of the study were to create climate and health audit tools and to actually conduct the data audit on those countries. And then the audit tools was designed for multiple types of stakeholders, specifically people working in disease surveillance, vector surveillance, like entomological indicators, vector controls in the institutions, but as well in the community. And then also we had the chance to work with people working in climatology, meteorology, and people responsible for the data collection, data analysis in order to produce reports. So mainly we found that all the three countries expressed really a big desire to bridge the gap between climate and health sectors, communication and program interventions. So the health sector specifically were very interested in finding ways to share data and ideas as they all valued the importance of climate influence on disease transmissions. And then the climate sector in each country also agreed of such importance. And stakeholders, so because we discussed with all the stakeholders, they agree that it's important to better link epidemiology data to vector data to better risk analysis determinations. And then we have also a lot of interesting findings, such as the work that they are doing in the communities in each countries, and then the surveillance that they are doing in all of the countries, and also some test and continuous education and information, not only for the people working in the ministries and organizations, but also in the communities. So the result of this audit, we can say that it provided the groundwork to develop an early warning tools and also other studies in future efforts.
Forecasting outbreaks can develop faster responses through early warning systems. But what are the other uses for the information?
So one of the efforts that has been going on throughout the Americas, and this has been supported by the Pan American Health Organization and national ministries of health, is the creation of local or national level observatories of climate and health. And the idea of an observatory is that you create some kind of virtual platform where we can bring together climate information and health information into different visualization tools like maps, charts, diagrams that are easy for decision makers to come in and look at the information and use it to inform their decision making. And so, this kind of data audit tool that Willy described that we developed in the study could definitely be used by other countries to better understand the information that already exists in the country and to support the development of these sorts of integrated climate and health observatories, which is really an important first step towards being able to develop any kind of climate tool for the health sector.
Why should we consider gender in the prevention, spread, and control of vector-borne diseases? Avriel gives us the breakdown.
So, because of existing societal gender norms, women are traditionally responsible for care and work in the household, for example, water collection and storage. And so, these activities are putting them in closer contact with mosquito breeding grounds and therefore at a greater risk of contracting arboviral diseases, these mosquito-borne diseases. These norms also mean that women are responsible for providing care to those that are sick in the household. For example, in the case of Zika virus, women were caring for babies born with microcephaly, or in the case of dengue, women are caring for a spouse or a child that becomes ill. So, this idea of gender mainstreaming uses strategies that place these gendered issues at the center of attention and thus can contribute to the effectiveness and sustainability of mosquito control. And so the other big idea here is that having better representation of women in mosquito control programs, especially in leadership roles, will allow for better production of new interventions.
How does the increased representation of women make a difference in vector control programs? Dr. Stuart Ivara and Avriel relay the benefits of female leadership at the program and community level.
So I'll just touch a little bit on the study that we did. We conducted a scientific literature review, taking hundreds and hundreds of papers and narrowing it down into some key findings that were really insightful. And part of that found that women, especially when they were exposed to seeing job applications of vector control programs, were able to actually elevate within the leadership role position. And there are just such a difference in the background, and women have different thoughts and processes. So if you can understand those better as a woman, speaking for myself, there's different ways that you can communicate an intervention and establish new protocol that perhaps men are not thinking about.
And I'll also mention, this is from some of our experience working together with our team actually in Ecuador. We've worked a lot with community leaders to do vector control interventions. Many of those community leaders are women, and we've seen just the tremendous role that they play in weaving together, holding together the community, and coming up with creative ways to reach community members, especially those most vulnerable. That's from our personal experience. Maybe Avriel wants to comment on that since she's really been leading those efforts. And I mention that because I think there is certainly some relevance for the Caribbean region as well.
Yeah, definitely. I think another big thing to touch on is safety and security. And so a lot of times when you're on the ground doing community surveys, you're really interacting with a lot of women because they are the people that are, again, traditionally speaking, maintaining the household. And in some of our research within this literature review, as well as personal experience on the ground, we're seeing that women are more comfortable talking with other women. And so having an increase in vector control personnel that are women allows for a little bit more, openness in the household to discuss. We did find in some of our research that some women are hesitant to allowing male counterparts to come in to the household to talk about vector-borne diseases. So there's a lot of different aspects that you can really get at, but definitely safety and security is a big one. And we've seen tremendous leadership roles within the communities that we work with in Ecuador, and then again throughout some of our readings as well in the Caribbean.
An intriguing connection made in the study was the link between women's sexual freedom and mosquito-borne disease prevention.
So in the case of Zika virus, for example, we know that Zika virus was greatly affecting women in part because of the pregnancy-related issues that were forming with microcephaly. And so when this happened, many countries around the world imposed different policy or recommendations saying that women should practice abstinence, or women should, make sure that they're taking responsibility for, their sexual freedom, and, just don't get pregnant, which is not something that is that easy to do, especially if you don't have access to birth control, if you don't have access to safe precautions, and even in the theme of, having those educational capacity trainings out in the community. Again, it was really focused on, it is the women's responsibility to ensure that they would not get Zika virus. So that way they would not have kids that had microcephaly. And then also they would bear the burden of taking care of the child that did have microcephaly, which is very challenging. So I think talking about sexual freedom and making sure that women have access to birth control, safe access to healthcare is really key, especially in some of these vector-borne disease transmitted areas such as Zika, which is also sexually transmitted.
Unsurprisingly, the COVID-19 pandemic created setbacks for the team to carry out their work.
One of the sort of major successes was bringing together the climate and health communities and playing our small part in being able to build and strengthen that community of practice at the national level and at the regional level through support from CARFA and CIMH, the Caribbean Institute for Meteorology and Health. And that has really built on, ongoing engagement with the climate and health sector in the Caribbean region since 2017, which began in a previous project led by CIMH. And so that effort to bring together the stakeholders is really critical, because that's when we begin to build the trust, build those relationships, understand the needs and the interests of the health sector and how the climate sector can respond, also the capacity gaps, what each partner is able to bring to the table. And we start to ask some of the tough questions also, like, if we are to develop this early warning tool, who's going to support it? Who's going to sustain it? What institution will house the tool in the long term? Is there really the support to develop and support this tool in the long term? And so a lot of the work has been around building a space of dialogue to bring together these different communities at the national level and at the regional level.
What were some of the positives from conducting a regional health research through a gender lens?
We also were able to get a better understanding of the data that's out there today and what could be done to develop early warning systems at the national level. So to better understand the limitations and the opportunities to develop these sorts of early warning tools. I would say today, more than ever, we have access to high quality, long-term digital records of health information that may not have existed 10 or 15 years ago. And today, many countries in the Caribbean region have, at least 10 years of health records that could potentially be used to develop early warning models and climate information for a much longer period of time. And so that's a really promising advance and an opportunity for the region to be able to continue to work to develop different kinds of early warning tools.
The road towards gender integration in health also looks promising.
We were able to identify key recommendations to bring gender dimensions into vector control programs. I'll mention just a few of those. So some of the recommendations were thinking about strengthening the recruitment of women into vector-borne disease control and prevention programs, and encouraging women to pursue leadership roles once they enter vector-borne disease control programs. Also, designing actually insecticide spray equipment that's suitable and comfortable for women to use. Some of these sort of really key practical recommendations could make a big difference to bring women into the workforce. Also, being able to increase awareness of vector-borne disease control by working with women's groups, schools, and different opinion leaders. So bringing these sorts of gender and vector-borne disease topics into the mainstream to better to ensure that the societies are better able to respond to the threat of vector-borne diseases today and under future climate change scenarios. So lastly, I'll mention that all of this work is through what we would call a co-development process. I know we've talked a lot about this process of collaboration and engagement, but this is really fundamental. This is kind of like the foundation that guides all the work that we do. And so co-development is this idea that we bring together experts from the sectors, for example, climate sector, health sector, bring together experts from different diverse academic disciplines. Like in our case, we had physicians, public health experts, mathematicians, ecologists. And so we create this diverse team to be able to really address these on-the-ground problems and come up with practical solutions. And so this co-development process really brings together these different opinions, different perspectives to create a common vision of a solution. And it's an ongoing process that requires building trust and relationships. And so that's a fundamental message we want to get across, that how you do the work, how you do the science or the projects is really fundamental to thinking about where we're going from here.
One of the major takeaways from the project was ensuring the sensitivity to cultural norms within the different Caribbean countries.
I would add also something on that matter, but because it is important for gender, it is important to respect the gender, but it is important also in the work that we have been doing in the Caribbean as have taught us to respect the culture. Because each country in the Caribbean has its own culture, its own history, and working in this diverse team and also collaborating with CARFA, with other regional organizations and other in-country organizations. Also, we have learned to respect each cultures and to adapt ourselves. And so when we are going in each country to do the work, we respect the cultures, and then the recommendations that we produce, they are not just for the whole Caribbean. Of course they are for the whole Caribbean, but we make sure that we adapt each of them to each country.
Aside from the data they're meant to gather, multidimensional studies like gender health research help to identify and better understand systemic issues that stand in the way of achieving success for public health programs.
I will say also, in working with CARFA, we've been able to work side by side them, and I think that addressing these social health inequalities in the development of early warning systems for future projects and other research is the key to sustainable implementation, and having this gender-focused, equity-focused intervention will allow for long-term actual change, because we're seeing that we really need to be focused on this, not just here, but globally. So I think that this will be a huge global health initiative in the next coming years, and something that everybody should be paying attention to.
The CaribClimate podcast is produced by the Investment Plan for the Caribbean Regional Track of the Pilot Program for Climate Resilience, funded by the InterAmerican Development Bank through the Climate Investment Funds and implemented by the Project Management Unit of the University of the West Indies Mona Office for Research and Innovation. The CaribClimate podcast, using data to make climate resilience greater.